The Western Cape Department of Health has decreased the backlog in surgical procedures by 70% after a budget allocation of 20 million rand. Now, this follows the extreme impact COVID-19 had on all health systems as the pandemic was prioritised. As one of the 3 large district hospitals in Cape Town, work is done to continually address the backlog in surgeries.
COVID-19 brought every aspect of the health system to a focused point of care, the pandemic. This left little to no room for any other services to continue. The extra budget allocation of 20 million rand was solely for backlog surgeries. Last year, that figure stood at around 77,000. As of the end of February, the figure was brought down to just over 21,000. The extra budget allocation only extends to the end of March, but such interventions are deemed critical.
Ideally, it should be like that, but we're still working with a team around that aspect and taking note that our budget this year has been decreased by about 1.5 billion. Just to make you understand, that budget is a budget of Kalbrima Hospital, Mitchell's Plain Hospital, College Hospital combined. These are 300 plus beds hospital that they could be. So when we have such a shortage, it means that we have to rob Paul and pay Pauline. But the surgical backlogs and the mental health, which is also we added 30 million additional last year, it still has to form part of the priority.
At Karl Bremer, the waiting time for an elective surgery before the pandemic was up to a year. Simple conditions that need surgical intervention could become serious because of the long waiting lists. Addressing the backlog improved the waiting time to 6 to 10 months.
And with the team, we planned and implemented what we call the Surgical Backlog Project. And to date, in less than a year, over 300 patients have had much-needed surgery performed over and above the normal lists that we operate every week. It's been a huge impact for the community and something that we're very proud of.
Some surgeries were done with the Da Vinci X1 robots at Grooteskier and Tygerberg hospitals. The robotics approach shortens the length of hospital stays and frees up beds quicker. Mariska Botha, SABC News, Cape Town.
For a little bit more on this, we're now joined by the Western Cape's Health MEC, Dr. Nomafrench Mbombo. Thanks so much for joining us, MEC. You must be delighted with this reduction in the backlog in surgeries. How did you do it?
Thank you, Peter. We've done as much, but there's still more to do, and that the funding might actually now come to an end. It's quite saddening. Surgical, not only as an operation, but surgical systems is an essential service, just like any other service, whether it's HIV or any other services. So indeed, we've done as much as we could. This is just an example of where it's happening in Kalbrima. Outside the metro, we've done a lot in Paarl Hospital, in Worcester Hospital, in Garden Route Hospital, and also in addition to that, we have got for Tygerberg and also for the Grooteskier, we've got additional 100 for the actually for the robotics.
What caused the backlog, MEC?
Before pandemic, actually before 2020, we had quite a whole lot of the waiting list in different disciplines of the surgery. We talk about the elective surgeries like the knee operations for all other operations. And then when COVID came, it meant that we have to delay as much operations because we have to prioritize the pandemic. It meant that I think 2020 until now, we had about 77,000 of the backlog. At least I'm happy that now from Feb 2023, we managed actually to decrease that up to 20,000, which is 70% of that. Generally, in the health system, whether in the Western Cape or anywhere else, there will always be a waiting list, just like there will be a waiting list for housing and everything. But with the COVID, it meant that the waiting lists get more in terms of the additionals because that we have to prioritize COVID. I just also must understand, Peter, just to add that with the interpersonal violence, with the injuries that are happening, you'll find that these are not elective surgeries. It means that the emergency operations, like, for example, to take the bullet out from those who have been injured, that it cannot wait any longer. And also, you'll find that we have to now compete with, for example, if you have got the breast cancer patients who need also some of the surgery in terms of the removal of the tumor and so forth, they have to compete with all the rest. So the 20 million rands that I added as an additional budget in my last year's, in terms of the budget speech, it made such a difference. But actually now from 1st of April, we don't have the guarantees because we have got 1.5 billion decrease of our budget because of the decrease in Equitable Share and also of the decrease in the conditional grants, which is the money that we actually get it from the National Treasury.
So what does the funding buy you? Is this more doctors and more nurses to perform these surgeries?
Indeed, yes. For example, in Kalbrima, we ended up adding a specialist in orthopedic surgery, which is actually what has made them to contribute to the most of the waiting aspect of the surgeries. In other aspects, for example, in the West Coast, it could have been, for example, for minor surgeries like cataracts, which is quite minor. It's supposed to be it doesn't take long, but because you end up not having those people to do the jobs. So it has contributed a lot. In George, we have added where we could be able to appoint people for 30, for the 1 month, for the 1 year in regard to all of these surgeries. So it's a staffing, it's also about the resources, it's also the time. In Kalbrima, where I was today, noting that the surgeries can only happen during the week from Monday to Friday. Over the weekends, nothing is happening. But that the team has been able to add extra days, specifically for the orthopedic surgery, it has made actually quite much of a difference.
Why has your allocation been reduced in the next financial year?
The 1.5 billion of the annual budget, because of Equitable Share, it also affects the Gauteng. The motivation behind that from the National Treasury and National Department of Health is a result of the trying for them to ensure that there's equity. Of course, in the Western Cape and also in the Gauteng, there are more of insured population, which is those that are actually have got medical aids. So one cannot argue against in regard to the equity. However, one doesn't consider, for example, in the Western Cape, we have got many of the interpersonal violence compared probably in other provinces like in Mpumalanga, on the Eastern Cape. So in principle, one can be able to accept the fact of the equity. Just like in the Western Cape now, for us, we are making sure that the rural community, the vulnerables also have got more of the funding that goes there. However, it doesn't take into consideration the upstream factors. As I've alluded to, Peter, that the violence that is happening, the gangsterism, the substance abuse and drugs will always happen in the areas where there's a high level of the economy. People leave their rural economies, Mpumalanga, Eastern Cape. I'm also born and bred in the Eastern Cape. Then they come looking for, not only for the jobs, but for the economy in this kind of the provinces, which is good because we are not in the Group Areas Act where people cannot move. However, money doesn't follow the people. It means now that we have to do whatever we could be able to do. Just like in COVID. In COVID, we didn't get much money from the national The provincial treasury have to add more money in order to be able to fight COVID, but there is no COVID money now. It means that we will end up having the same budget that we had pre-COVID that was allocated.
How has the Nehau strike affected health delivery in the Western Cape?
I must just say that luckily in the Western Cape, we do have a good relationship with the unions. Probably the contributing factor is about where we reach out and find a way how we can be able to have these kind of conversations. Therefore, the only time that it affected us mostly, it was, I think, 4 days ago on the first day. But specifically in the areas of the Khayelitsha, the Gugulet, and some parts of the Mitchell's Plain, where we saw some of the protesters will prevent staff coming to work. It resulted to some of the staff having to work 24 hours in those kind of areas. So thank you for the staff for that. But generally, afterwards, it hasn't impacted on us in as much as that is some of the admin support in other areas. They didn't come to work, they were protesting. But today and also yesterday, like Friday, I was in Khayelitsha, we may have had such an impact. However, Peter, social development and also some other aspects, other areas in education, they've been affected. That's why we ended up going to court to get an interim interdict for this. As a health professional myself, we do understand in terms of where, what is the point from coming from the unions representing the workers, the health workers specifically during the COVID. These are the ones who have been on the face, whilst other people were staying at home. The health workers were there for everyone. And when you look in terms of the coalface staff and also in terms of the increase in the salaries and other remuneration, they didn't get much. And it hurts when you see some of the monies going to bail out the SOEs instead of prioritizing the workers. So we as the Western Cape, we do support when the workers demand what is due for them. What we don't support is when there are elements of the violence, the elements of intimidation, which we saw in some of the other areas, like in Khayelitsha, where the doctor has to plead with the protesters for the ambulance that was taking a sick child to go to the Tygerberg. So we don't support that. And that's why we have to go to court in regarding to that. I just hope that the national government and the bargaining council should be able to deal with this as early as possible.
MEC, I'm going to have to leave it there. Thank you so much indeed for joining us.
Thank you very much, Peter.
Good night. All right, that's the Western Cape's MEC for Health, Dr. Nomafrench Mbombo, speaking to us about the gains made. They've reduced the backlog in terms of elective surgeries by 70%, and saying that the Nehau strike has been a concern, but they seem to have a better relationship with the unions in that part of the country.